Okay, I'll go ahead and call us to order. It's 2:32 on September 21st, 2020, and this is the Incarceration Prevention Reduction Task Force Behavioral Health Committee. We do not have a quorum at this point, but we are expecting more members to join the call. Our first item this afternoon is agency needs for changes due to COVID. I sent Jill a note asking who put that item forward. Or if that was something that you gathered, Jill, out of the conversation last time, or if people had specific things they wanted to talk about for that one.
It was mentioned at the last meeting that it would be good to have everyone go around and give an update on what their needs were as a result of the COVID pandemic. So.
Okay, that's a good place to start, I think. Hey, anyone want to go first? Sheriff's Office, maybe, or Mr. Hilly?
Yeah, I don't mind kicking it off. I'm kind of doing a little bit off the cuff here, but you know, for EMS, the changes for us are just involved in how our responses are going out there. You know, we've seen an uptick in mental health calls, uptick in overdoses, that type of thing. And then, you know, how to respond to these cardiac arrest and trauma calls without getting other people sick. And that's been our biggest thing. Probably the second most challenging for us has been training. So getting people back together just to get their mandatory training and stay updated with all the state requirements, which involve touching and you know, practicing with people. And along that lines, the biggest struggle is we normally enjoy hospital access for those activities. However, our paramedic students and paramedics who go there regularly for skills haven't been able to do that either. So a lot of operational, not necessarily affecting how we respond, but our operations have changed a good bit of it. I could probably talk all day long about the COVID effects, but I think those are probably the major ones for us.
Cool. All right. Thanks, Mike. Doug, you were going to go?
Sure. As far as the Sheriff's Office, I think obviously everyone's aware as far as the jail, we've had to modify our protocols there and really make sure that we're screening people. What we you know, early on, we significantly reduced the population, and thus far, knock on wood, we haven't had any infections, which is quite frankly, it's pretty surprising. But again, it's there's fewer people coming in the door, and like I said, they're doing a great job of screening people and trying to address anybody that may be symptomatic and make sure that they're seen by medical staff and cleared, and then working closely with the prosecutor's office just to get people released. And unfortunately, there's going to be a big backlog for the court system when that does open up, but we'll deal with that. Like Mike said, as far as patrol, we're still having to respond to calls for service. We have seen a reduction in some of our proactive enforcement, but again, we're still responding. And again, we haven't had any deputies that have, you know, we haven't seen a significant impact on our patrol force, which again is something that we anticipated early, but we have seen a significant increase in the mental health calls. And I think that's, you look across the country, that's a national trend. And again, drugs and alcohol just kind of go along with that. Usually we find that as a co-occurring situation. So trying to address that. And I know there's other programs and there's been a lot of work over the last couple of years. And I think that's all going to kind of come together at the end of this and help us all out.
Hey, Doug, I've got a couple of questions for you.
Sure.
What is the jail census, or what is it around for like this during this COVID time?
We're down. We were down about 50%. We're slowly creeping up as some of the courts are starting to open up, and again, we're you know, we're starting to bring people in again. I think the protocol's in place. I want to say we're maybe at about between both facilities, maybe at about 150, 175. That's just off the top of my head. I can probably get you those numbers by the end of this meeting.
Okay, it'd be helpful. I'm just trying to frame this, and then my other question is, you know, Prosecutor Ritchie talked about doing stipulated orders of continuance and not charging felony for VOXA for drug possession and such. I want to get your perspective on that, and what do you think about those two things, and are they going to be, is that going to affect public safety? Are there going to be blind spots that we don't see? Just from your professional perspective, what do you think about those things?
You know, I think it's too early. I think what we have seen is some of these people that have come in and have been immediately released. We're seeing these people reoffend multiple times over a short period of time. So it's kind of that accountability piece. So we've got to figure that out. But you know, I think there's some crimes that we can probably address that, and I know that Prosecutor Ritchie's working on that, and he's working with multiple groups on that. But again, we're starting to see some recidivism from people that are coming through and immediately being released or not booked at all. So it's not having for some people they're continuing to commit crimes because there's no accountability.
Okay, that's what I was afraid of. I know that's come up in other conversations, and there's kind of like this perspective, like, well, let's just try this and see if it works. And the problem is it's not working to the degree it should, or in theory or whatever. But I'm a little, I don't know. I have mixed emotions about that one. Public safety is our number one priority, and we have to adhere to that. So
Sure.
Okay. All right. Who else wants to go? I can't see all the.
Excuse me, just one second. I just want to state for the record that there is a quorum.
Oh, okay. Who joined?
Byron Mannering, Sept Fleetwood, Megan Blue, and Mike Parker is back online.
Okay, great. We are going around and we're talking about each agency's changes as a result of COVID and the things that are just having to change. Mike, do you want to go next? Parker?
Yeah. Can you all hear me?
Yeah.
Oh, good. Sorry about the technology issues earlier. I had bandwidth and everything, and I'm like in the middle of Deception Pass State Park, and I thought things were great, and then nobody could hear me. So real quick, for Opportunity Council, obviously we're not a behavioral health agency, but we're serving tons of people. We're seeing a lot of need. We're seeing a lot of need from different people, and we're seeing an awful lot of stress and concerns with people in housing and their stability. I think this is pretty congruent to previous reports, Dan. The other thing that I think is happening is that as this continues to go on as long as it is, we're seeing real slowdowns in the housing, meaning people are not leaving housing or graduating, if you will, from, you know, shorter and interim term things. This essentially means that there isn't a lot of room at the inn. So it concerns me that some of the people that may be recidivizing, maybe, you know, for some of those folks who might be experiencing homelessness, part of that issue is that there's even less, I think, housing availability. So in a nutshell, those are some of the brief pieces. I think in terms of stability for folks with behavioral health, it's a mix. We have some folks that are getting telehealth services and behavioral health and are really doing quite fine with that. And there are other folks for whom that is really not working and need more kind of assertive, I guess you can say, and face-to-face contact. And so that's been a challenge. And I'll stop with that. All
right. Thanks, Mike. Anyone? Megan, you want to go next? Changes to your agency, things you have an update?
Sure. I mean, for the most part, all of our services are still active. We just are 100% telehealth as far as our mental health counseling. One interesting trend we've set in, maybe kind of similar to what Mike was saying, that we're seeing actually an increase in the number of people and the number of sessions per month. And so some people are accessing telehealth that maybe weren't accessing our in-person services. The question is always, who are we not reaching? And so we have increased our crisis outreach. So these are community members that are trained, you know, being very careful with PPE, going out and trying to make contact with maybe some people we're trying to prevent people from falling through the cracks that aren't accessing care. We have increased our office-based Suboxone program through our medical clinic. So that's something that's changed a little bit since the last time we've met and given an overview. So just to provide additional options for people during this time. But yeah, the rest of our services are really similar. And so I'm curious to see what everybody else's experiences have been.
Megan, are you seeing any uptick or changes in Suboxone treatment?
So I think because there was such an immediate change because we just have the office base, which was basically daily dosing. So our Suboxone program before was I mean, I think you guys all know this, but it was basically an OTP methadone based model, but only prescribing Suboxone. And so right away, because of safety concerns, just had to change a lot of that, including spacing of people's doses. So that's partially why we also increased our office-based model. We're not really seeing an increase in individuals. I think it's interesting to see who's deciding to access care through a different model. So hopefully we're able to maintain people through different options, but we are hearing reports through our probation and some of our other recovery services about relapses. I just got on right when you were talking about some changes in legal services, especially with people that were involved, for example, in the drug court program, when some of that regular check-in was paused, that there were some increases in relapse compared to what we saw pre-COVID. So hopefully we're going to stabilize as our courts open back up and we're able to do a little bit more of that.
All right. Thanks, Megan. Hey, Byron, you want to take a spin? Just describing what's changed at your agency and things that are going a little bit different since COVID.
Sure. Thanks, Byron Mannering from Bridget Collins. We feel kind of completely different, right? We went from 100% in-person, treatment services to basically 100% virtual, and doing that work from home as well. So we've been able to kind of totally change out our IT system, and also implement a new Axon evidence.com system for handling of evidence for our forensic interviews. So it's kind of what we're seeing is a real resurgence of the number of cases of that were being investigated for child sexual abuse. Started to kind of go up for the last month, and then all of a sudden it kind of stopped and slowed down. It's kind of interesting. I'm not sure why. It's kind of fortuitous because we were putting in this newest system for managing the interviews. But we'll see. It's happened. The same thing happened down in Skagit County too. So I'm not quite sure what this kind of big kind of push there for a little while. Now it's kind of going back down again. So I don't know. We're doing that work right now and continuing to follow through with that. So we haven't really seen a whole huge change in our caseloads. They haven't gone down right now, and they're pretty much what they always have been. And it feels like the crises that our families are going through are kind of pretty normal, almost back to where they felt like they were before. Although we are asked and frequently wanting to increase time, face-to-face time with the counselors. So we are offering and up to capacity about 25% of face-to-face visits right now in terms of what we're providing. So about 75% telehealth and 25% in person.
Okay, thank you. Heather, do you want any changes over at Chuckanut Health Foundation?
Not like the changes you guys are talking about. We are just working remotely as long as we can, and we do have an open grant round coming up. We are concerned about a number of the things that you're sharing as providers, and we'll certainly share back what we're hearing from our community grantees about the issues. So thank you.
Okay, thanks, Heather. Mayor, do you want to any thoughts for the city you wanted to discuss, changes that we're going through?
Yeah, so many things are similar to everybody. Significant amount of the force is remote. It's been a very active year of all the department heads sort of responding to how they deploy their people, given the realities of things. So I suspect a lot of similarities in that respect. Lots of protocols that the entire staff is expected to deploy, all the basic stuff. And we're expecting to continue it throughout for indefinitely. It's going to be really interesting to see how the world returns after all of this, to what degree society has changed permanently as it relates to the work environment. But thank you. I've enjoyed just listening to the and learning from all of this. This is the first Behavioral Health Committee meeting I've been a part of. My understanding is Mayor Linville was on this committee, so I'm sort of picking up where she left off. How many people are on this committee, Dan?
There are 13 people on this call right now.
Okay. Yeah.
Okay. Anything else, Mayor?
No.
Okay. I'll take a quick turn for council. When this thing began, we couldn't do anything unless it was very much ordinary or necessary business. So I had a piece of legislation lined up on, for example, single-use plastics and how we could maybe make some improvements there. Now that order's been lifted by the government, or by the governor rather, so we can go back to those pieces of legislation and pick them up. But what we're overwhelmingly hearing now is calls to address mental health, behavioral health stuff. So it's very much germane to this committee. I think it's and we could or can and should have those discussions. Is there anything else for this agenda item? Agenda item number 2, agency needs for changes due to COVID. Stephen or Arlene, anything you want to add to this?
No, not for me, Dan. Thanks.
No, nothing.
Oh, okay, thank you. All right, let's go to the next item then. So expanding committee representation. I guess I'll prompt us here and maybe we can have a discussion. One of the things we talked about in the last meeting was to consider having different voices on this committee, including people from marginalized communities, communities of color, people who have been impacted by the criminal justice system, and that's been a topic that's come up at the broader task force as well. So I want to push that conversation a little bit here this afternoon, because I think that we can benefit, especially from folks whose lived experiences are going to be a little bit different than perhaps the folks on the call. And I think that the work that we do can be improved if we hear those voices and listen to those voices. So with that, I'll entertain any thoughts by anyone, and just go ahead and unmute yourself and speak. Like, go ahead, Arlene.
Am I muted?
No, you're good. Go ahead.
Okay. This issue is important to me, so I've made it my business to find a couple of people that I can talk to who have these voices to offer us. And so I've been trying to, by talking with them, learn what are the basic problems regarding fairness, equity, bias, and the traumatic experiences that they have when they go through the system. So I'm looking forward to the time that we can add these voices. It's very important for them to be representing themselves. I noticed that each time we are talking about making changes, it often happens that someone comes in to talk about the changes who's an expert on the subject, which is not necessarily a person who has been an expert on the subject by experiencing going through the system. So it just seems just essential to have these voices. And as I'm meeting with people, I'm looking to see who of them might be willing to be people to serve as well.
Okay, thanks, Arlene. Mike Parker.
I'll save my comments because I think you're going to hear from me later in this. I've got a slide deck and I'm going to be talking about kind of the representation issue. But Arlene, I had a question, and I don't know whether you'd be able to answer this, but some folks have asserted that one of the reasons why committees such as ours aren't always so good at attracting and retaining, and especially retaining that we're talking about now that may have a lived experience going through a system, is that the format themselves really is not very inviting or embracing, or maybe doesn't meet their needs or time. And I'm wondering if you speak to whatever you know about that, do you think that based on maybe some of the folks that you spoke to, that this committee's form, its timeframes, its method of meeting would be amenable?
That's a really good question. I have not asked people that, but I will now that you're mentioning it. I think it is important. I mean, if I were to talk about it, I would be just theorizing about the reasons why. It could be that lives are more unstable and less ritualized by time, or I don't know, I would really have to ask that question. But I do acknowledge that that does happen, and I've certainly seen it happen. But, so I don't have an answer for it exactly. But I don't think it's a reason not to do it.
Okay, others, any thoughts? Mike Hilly.
This is Stephen.
Yeah, thanks, Council Member Hamel.
I think Mike, hey, Stephen, Mike had his hand up first. Is that okay if he goes?
Absolutely.
Okay, go Mike, then Stephen.
Yeah, thank you, Dan. And I'm sorry, I get a little delay. I'm on a satellite internet out here, so it kind of kicks a little slow. But we're talking about the voices out in the community and the things that we want to hear. I'm reminded that about a year ago, I sat over in the county council chambers it was almost a 10-hour day when we had a flow of people coming in wanting to testify about the proposed mental health facility and the needs assessment for that. And part of that process was for, to learn about that so they could have that certificate of need for the beds at the time that they wanted to bring in the community. And what really struck me about that testimony, and really wasn't so much about the new facility, but it was about the needs. And it was a nonstop flow of people coming in telling that group, the county council, about the horrors of the current system and how they experienced all those failures themselves. And I'm not sure where we would get a copy of that meeting, but it was very telling. In fact, it was, from my perspective, very emotional of all these voices talking about their family members or even their own experiences of trying to get mental health services, not only in an urgent way, but in a long-term way. And we see that play out in our GRACE program every day. We see that play out with the case managers who can find some treatments for somebody only to get to Spokane and have the door shut on them, or down to Centralia, etc. So I'm not sure how to gather that information again, but there were a lot of voices in that meeting, and it was a long day.
Jill, I'm wondering if so we contract with you all, or you contract with us for BTV 10 services. I wonder if we can get at least a link to that testimony.
Yeah, I'll do the research to find out which exact meeting it was and then send everyone a link to the video. How does that sound?
Great. Okay. Stephen,
I'd like to respond to what he just said.
Go ahead, Arlene.
To me, what I hear and what you're saying is that the trauma, that some of the trauma comes from the fact that we don't have the services that we need to have to serve our people. And I'm responding to it because I've been busy sending around my list of missing parts in the mental health system. I certainly have contacted Dan and Mayor Sept and the city council and the county council, because the city and county are now making plans to make significant changes that are going to serve our community, our mental health and addiction community, much better than they have in the past. But my point in describing the whole system, all the missing pieces that we have, which is what those people are testifying about. They're suffering from not being able to get their loved one in a hospital bed in a timely way, which they don't mostly do. The list has what we're lacking. It has the services that we're lacking. And so eventually as time goes by, we have to address each and every one of those things and probably many more. But that's how much I've been able to do so far the last 10 years. And I see it as a large, enormous web of social service connections that if threads are missing, people fall through those threads and do not recover and don't stay stable. And that's our big problem, of course.
Okay, thanks, Arlene. Stephen Gockley.
Thanks, Dan. 2 comments. I certainly think we ought to emphasize representatives coming out of the BIPOC communities. I also think we should be thinking about people lived experience in the services that we are working with in this subcommittee. And so one potential source out of that latter group might be a successful graduate or 2 of the drug court program. I've had recent conversations with Chris Furman on other aspects of drug court, but it occurs to me that she might be able to identify some people that she thinks would be valuable contributors to this. My second comment is anybody out of any of these groups that we take on is going to have different needs for integrating themselves and contributing to the work of the community. I think that's a common message we get back from unrepresented communities is these are foreign environments to them. They're not professional people. They don't have resources of their own. So I think onboarding somebody like that would be really important. I think a face-to-face, whether Zoom or in person kind of meeting, maybe with you and Mike to understand what we're doing, the background of what we've done, some of the goals that we already have, and some of the ways their experience could inform the work of the community would sort of integrate them at the front end a little bit better and maybe give them a little more context to feel comfortable participating in this.
Stephen, who was I missed the person's name. Heather, I'll get you in just a second. Stephen, the person's name that you mentioned from courts? Who was that?
Furman. She's the therapeutic courts coordinator for the county.
Okay. I'd also add to that list Maya, I think her last name is Vanyu, V-A-N-Y.
Vanyu, yeah. Yeah, she's the public defender. Shoshana Page is the public defender handling drug court. Also, we've had before us here Linda Grant for mental health court. She might be able to identify some people as well.
Okay, I want to circle back to the action item that's associated with this, but I want to take Heather Flaherty real quick.
I think I agree that we should always have space on committees like these for lived experience and always try to reconcile that the wonky language can be super off-putting for people with lived experience and we might lose them along the way. And I wonder what the committee can do to access the voices that we already have heard from, to access those reports and to make it part of our ongoing work plan together, that we have, maybe it's a lived experience advisory meeting, right, where we can check in once or twice a year versus having them be a part of every single meeting where we talk policy. And I just think there's other mechanisms to get that voice and that input. It doesn't necessarily always have to be they are an appointed committee member. I think it's us going to them as well.
Okay. Megan, did I see your hand or not?
Yeah, and I know you were trying to get back to that item, but just to kind of discuss, I think that there's a recovery coach, for example, that's on our staff that would be amazing as part of this. I really like what Stephen said about, you know, if we are going to integrate somebody into the committee, having some ways to make them feel comfortable. I was just picturing her being part of this meeting right now, and while I've learned so much from her and she would have so much to add, I bet she wouldn't speak, you know, during the meeting, especially, you know, if I told her she was going to a meeting with the mayor, she probably wouldn't show up. She would be so anxious, honestly. It's just nothing about you, Mayor Fleetwood, but just, you know, just that idea of not feeling like she is in the right place, although she has exactly the voice that we would want to hear. So I think just being very strategic about how that was to happen. But I do think she, like somebody like her, I have her in mind because she's amazing. It just would be such an amazing voice to have here. She has her own history with substance use, with incarceration, and now she's really a model and a leader in her own community at Lummi. So if there's a way to make that happen, just being really thoughtful about making people feel welcome and actually, you know, equally part of the group and not, you know, not feeling like they are, I guess.
Those were all excellent comments. I think the way that I heard that was the how that we do this is as important as the what that we are doing, if that makes any sense. That we have to be sensitive, inclusive, and not tokenize anybody. I don't want to put people on the spot as like the subject matter expert on addiction or behavioral health or whatever, but I want to be able to find a way to create the space to allow for people's voices to be heard. Very important to our work. As I think Mike said, you know, during that testimony, Hilly, during that testimony, there were complaints, and maybe it was Arlene as well, about the system itself. And then, you know, I think we need to hear those components. I'm interested in Heather's idea about the more of like a twice-a-year summit, or maybe that's a way to do it without putting people on the spot. I agree. It would be intimidating to be on this call with law enforcement, with the mayor, and yeah, I don't think I'm very intimidating, but maybe just the title or something. I have no idea. Okay, I would like to make sure that we follow up on this though, and that we are able to at our next meeting report back with some type of either deliverable or deliverable in process. And I'm wondering if there's anyone on this call that might help take the lead on that, on this piece, if anyone wants to volunteer for that.
Megan, do you want to do that with me?
That sounds lovely, Heather. Yes.
And anybody else is invited too. Not to just voluntold Megan.
Thank you, both of you, for your leadership on this. This is great. And yeah, excellent. And thank you. Anything else pursuant to this item before we move on to the next one? Okay, go ahead.
Just real quick, I think it kind of speaks to a bigger issue. It's not just this community. I think we need to come up with a better way to, you know, attract people from our underrepresented communities to all the communities. And that's, I mean, ideally, your committees, your agency should all be representative of the community that you work in. So I think throughout Whatcom County and all the cities, we need to do a better job of making people, you know, one, letting people know and just passing on the information. But it's not just this committee. It's you look at committees across this county, and again, I know there was an article in the paper. You're looking at agencies, and they should all be reflective of the community. So that's just, as Whatcom County becomes more diverse, hopefully you'll see that.
Thanks, Doug. I absolutely 100% agree. Okay, anyone else wanting to bring up any for this item? Okay, I don't see any. And if you do, just raise or just go ahead and unmute and talk. Okay. All right, then seeing none, item 4, communications planning. I think this is from my perennial complaint of not being government not being as transparent as it could be, especially around these issues that we're getting forward motion on, and a lot of that happens within this committee, within the task force, within the other committees associated with the task force, and sometimes that happens at the county council level and at the city council level as well. And so I guess the meta on this one is I'm trying to figure out a way to have better outward facing public communication on the work that we do. One idea that came to mind in between our last meeting and this meeting is that we would meet in a airless, windowless bunker room at the county health department with an audio recording, right? And so who would go and scrub that audio to find out, you know, the thing that they were interested in, or even know how to know to do that? One improvement, it's a very small one, is that this meeting right now is being recorded, And I guess if it would be a little bit easier, I think, for people to kind of scrub through video to get to something. Maybe it's a little more interesting than just the audio tape. I've talked with Marty Mulholland, who's our IT manager at the city, about maybe if it was possible to make these meetings public in some way, either on BTV10 or on YouTube or some way. I think they're looking into that. I think that's a tiny improvement, but it's an improvement. And so what I'm asking for this committee is any other ideas on making the work that we do more public facing beyond like the annual report that we put out with the task force. Are there other ways to do that? Go ahead, Mike Parker.
Thanks, Dan. I've been on some calls on some statewide consortiums. They're using a live transcription service. And when we talk about accessibility for folks that are needing video to be able to listen, can be really difficult. And so it's called Otter AI. I'm not plugging it. I don't know how it works or what it costs, but it's an interesting concept that we might be able to, for folks that that might have challenges hearing, it could increase accessibility to all types of meetings. So I just want to throw that out, that we look at it also from an accessibility standpoint, and that could be a solution regarding folks that may be hearing impaired. It could still give them a way to interact.
Okay, good, Mike Parker. Any other thoughts on this one? Let me prime the pump just a little bit further. So over on the lead communications committee, that's the law enforcement assisted diversion committee. I'm on that one. We've actually hired a outside marketer to create infographics, communications campaign, talking points, public service announcement for an upcoming meeting that we have with 70 local electeds on October 27th. I don't know that we need to go that far. That's a several $1,000s expense. But I would like a way for us to encapsulate the improvements that we're working on, the things that we are visioning out in this, and to the earlier points, the system challenges that we all know are there, and how we're trying to address those particular issues. And perhaps that's something maybe just on a small contract, once a year we hire somebody to make pretty pictures. I don't know, I'm not a marketing guru or anything, but like, a way that's for the public to interpret what we're doing in a very easily digestible way. I don't know if there's any thoughts either way on that particular item.
Dan, this is Jill.
Go ahead.
I want to let you all know that in terms of video recording, we are video recording these meetings, and my goal is to post the video versions of these meetings, all the task force committee meetings, on the task force website, starting with the September meetings. I just have not been physically in the council office yet to do that behind the scenes technology stuff that you have to do to get it uploaded. So that is coming. And we have talked with the county IT staff about the possibility of posting these meetings on the county's YouTube page as well. So that's happening. And I also will let you know that I had a conversation this morning, or this afternoon, with Barry Buchanan about communications planning. And I think that's going to be on the steering committee agenda this Thursday as well. And the last thing, I think, was Mike, you had a suggestion for transcription of video services. If you could send me that information, that would be really helpful. Thank you.
I'm happy to do that.
Okay. Okay, so it sounds like we're going to be talking about this at steering on Thursday. I can report back at our next meeting what we all came up with. Obviously, the idea is to make this as transparent as possible and push out to the public. But some of this came from the listening sessions that the mayor and Executive Sadhu conducted and council listened in on. And what I heard there was people talking about things that we were already doing. They just didn't know. They didn't know that we were doing those things. There was a person that was very concerned about children's issues around children, and we weren't, no one was talking about the children. Well, Heather Flaherty absolutely is talking about the children, and others, many others, and many of you, Byron, of course, and others. So I want to make sure that we are pushing that out. I'll engage the steering committee on Thursday, and if it pleases this body, I can report back to you all next time we meet at our next behavioral health meeting. Does that sound okay? Okay, and then Stephen, you and Heather, go ahead. Stephen.
Dan, there seem to be two aspects to the communication side. One is pushing out some information about what we are doing and what we have accomplished, which I think you've been on for quite a while, and I applaud that. The other is a little more accessibility to our work as it goes on. And so Mike's suggestion and the video recording are all good. But even then, you know, it's daunting to look in on an hour and a half or 2 hour meeting and even a video recording of it and try to find where the part you're interested in. So I'm wondering if we ever do put up recordings of the meetings, perhaps we could put up the agenda with it, like right at the start, and maybe even annotate those after the fact. Jill, you'll have to tell me how burdensome this would be, but if we could say that the meeting on communications planning went from 32 minutes, 15 seconds to 41 minutes, 45 seconds, at least you could tune in to the recording where the topic that you were interested in was.
I think that's a great idea. Heather, before I get to you real quick, so I'm a documentary filmmaker, and one of the things that the most loathsome thing to do is called logging footage. It is so slow and laborious because you're going through every item, every conversation. So Stephen, your point, I think if we just did that simply, where at, like you said, this agenda item this time, next agenda item next time, that would be at least give people handholds to know within that parameters rather than where to start looking and maybe even capture some more information that was during these conversations. So I think that is good. Jill, would that be a big pain in the neck to do, or?
No, we can do that.
Okay. I think that's a basic step that we can do, and I think we should do it. Go ahead, Heather. Sorry about that.
On that note, I believe county council does that with the county council meetings and their committee meetings, and it is really helpful. One thing too so a couple things. One, I think this is an issue that is a Bellingham, Whatcom County issue, and it's an all government issue, communications, getting things out and people knowing what's happening. And it's not for a lack of trying or a lack of transparency. I really believe it's no secrets. It's just people aren't, I don't know. So I'm really looking forward to what the steering committee talks about. And I also think and wonder about our committee member role and responsibility to communication too, in terms of there are people that we can proactively communicate with that each of us know about, even on that kind of grassroots level. And if there's meeting summaries that we have a list of 25 key people in the community that we know need to know about this, we could easily do that too, So all the layers.
Yeah, absolutely. So I have pastors and congregations that they're just like, just tell us what to tell the congregation. That's 400, 500 people right there that we can push out to. So I think you're right. I think there's maybe just a little more mindful strategy of how to do this. And we, including me, needs to take ownership over that part of it. Any other thoughts on communication? Mike Hilly.
Just one thought, Dan. I'm wondering if it would maybe be appropriate to do sort of a panel conversation once a year that could be divided up into these particular subjects that we want to have people put out. And then maybe that's the opportunity for some of the voices to provide input back to us out there, similar to that testimony that I was talking about. And it could be a very, purposeful, contained thing, maybe an hour, hour and a half of you guys talking what we've done in the last year, sectionalize it out, and then each section could get some of that input. And might be a little bit of work, but might be a way to get input back. And certainly with us having to meet online like this, that might provide a forum to at least get the reports out, and then we back in through that. So it can be perfect.
I think that's a darn good idea, actually. And I think I'm going to bring that up on Thursday at steering. I think that's, that with the listening sessions, we listened, but I think that the other half of that is, okay, can we have a conversation? Can we talk about what we're doing? and then also maybe hear back during a public comment process as well. So I think that that's a good idea, and I'll talk to steering on Thursday, and I'll bring it back again on our next behavioral health. Good idea, Mike. Anything else on this item? Okay, that's going to take us to Racial Equity Toolkit. Mike Parker, you are up.
Okay, I'm going to attempt to share my screen and hopefully things don't blow up on us. Jill, is that something that I can do, or?
Let me promote you, Mike. That should
Ooh, I'm getting a promotion.
You're getting a promotion.
So as Doug's comment earlier, I was muted while Jill promotes me. It's actually my day off, and my brother flew in to meet his now 6-month-old niece. And so it's actually a day off, but I didn't want to let this go. I'm pretty passionate about this racial equity subject. So you get me today here at Deception Pass State Park.
All right, you should have the ability to share screen.
Okay. First of all, I want to thank you all for listening to me. Stephen has heard this before, so Stephen, you can tell me how I do on number 2. I just want to begin with, I think that there's a lot of wisdom and there's a lot of lived experience out there, and that I am not the best person to be discussing this. I don't have those aspects to my world. I'm white and a person of privilege. And I just want to acknowledge that I think that there are better and adept voices, but I'm here and I'm willing, and I did make you all a slide deck. So I'll take you through that. Essentially what I'm bringing forth to this group is what a lot of other communities or, the city of Seattle has done, which is really embracing that we have serious and deep issues with racial equity. Well, how do we operationalize that? It's one thing to care about something, but how do we operationalize it? So obviously with the Incarceration Prevention Reduction Task Force, our goal is to reduce incarceration. And from listening sessions and protest, we're hearing some of the feedback. You've heard some of it today. People want a criminal justice system. We want a society where all of our children thrive and also feel safe. And we want a system that is just and equitable for all. So one of the challenges is our systems aren't promoting that. They're not allowing that to happen. And that affects all of us. Here's a stat. This is national, and this is from the Prison Policy Initiative. And it just kind of underscores that point, that while 64% of the population is white, and I have to move this lovely faces off my screen, the percent of the prison population. African Americans are 13% of the US population and 40% of the prison population. So very, very serious in a criminal justice system. Sometimes people ask, well, why do we have to have these things? A lot of these laws are really kind of race neutral. I want to share with you some thoughts, and some of you may have read this book from Ibram Kendi about how to be an anti-racist. This is a really interesting concept for me. There's no such thing as a non-racist policy. I'll read a quote to you. There's no such thing as a non-racist or race neutral policy. Every policy in every institution, in every community, in every nation is either producing or sustaining racial inequity or equity between racial groups. You can think of that conversely as if you want to change something, if you want to change that status quo, you have to look at that policy and what the effects of that are. So that's useful, and that's the meat and the subject of what we're talking about every time we meet. One of my points is that I think that we can be leaders in the change in our system. We are already leading change. There have already been great wins since 2015 when this group started getting together. Dan and others on this call have been talking about we need to be able to share those. This doesn't say anything against those wins. It doesn't lessen those wins. But what we haven't done, that at least since I've been a part of this, is we haven't really looked at it critically and say, well, what are the impacts, right? We can be a leader in creating a racially equitable justice system. We can make sure that when we recommend a prevention, intervention, changing a law, that it's going to be as balanced as possible. And racial equity toolkits that I'm proposing, they help organizations move that needle. A particular toolkit that we're looking at was actually, Dan was one of the ones that brought it to my attention, but it's from the Local and Regional Government Alliance on Racial Equity. One of the reasons why this group is putting out something that I think is so useful and adept to the work that we do is because it is founded in and of and by and with governments, right, who are trying to implement reforms in ways. So really quickly, racial equity toolkits are designed to integrate explicit consideration of race equity in decisions, including policies, practices, programs, and budgets. It's both a product and a process. Use of the tool can help develop strategies and actions that reduce racial inequities and improve success for all groups. We'll later see that part of what racial equity toolkits do is they force conversations that we already had about who's in the room. But we're all about looking at these processes and seeing what these outcomes are. So I think it's a natural fit. So GARE's racial equity tool has several goals. Proactively seeks to eliminate racial inequities and advance equity, identifies clear goals, objectives, and measurable outcomes, engages community in decision-making processes. We were just talking about that. Identifies who will benefit or be burdened by a given decision, examines potential unintended consequences of a decision, and develops strategies to advance racial equity and mitigate unintended negative consequences. And finally, develops mechanisms for successful implementation and evaluation of the impact. I think a great way to sum a lot of that words, it really helps us operationalize. It takes it from, oh, I want to make sure that we're doing okay by this. It's a really way to operationalize that. So people ask, what is a racial equity toolkit? How complex is it? And obviously there's the beginning levels, and you can go very deep with this. But essentially, a racial equity toolkit is a simple set of questions. The questions are before you, and I won't read every single one of them. I'll just go over the highlights. So it's the proposal. What are you trying to do? Data. For us, that's like our index committee. What is the data about what's happening? Community engagement. We're just talking about that. Who's at your table talking about reform? Who are we consulting about the proposals we make? Analyses and strategies. Who will benefit or who will be hurt? Implementation. What is that plan for implementation? Are there possible snags in the implementation of an excellent policy that might actually be really problematic? Is the questionnaire that we have for home monitoring somehow biased, right? So we have to look very deeply. I'm just giving some examples of what I'm familiar with in my brief tenure. And the number 6 is accountability and communication. So one of the key things is, it's one thing to say that you want a goal and we want to try to advance racial equity, but we have to be accountable. So unless we're saying we expect this outcome and then we look at it later, we won't be able to do that. Another comment about a racial equity toolkit is that it's just the beginning. I mean, adopting and employing a tool is a piece to helping us shape an equity lens, or a framework, might be a better word, for creating just and equitable policies. It also provides really powerful information to help organizations or committee groups such as ours move forward in a more inclusive and equitable process. So one of the reasons why we're talking about this, because in steering, we wanted to expose people in the subcommittees a little bit more to the concept of a racial equity toolkit, show a little bit of what it looks like. And I'm actually going to pull that up. And Jill, is this something that everybody had sent to them?
The GARE, yes, I sent it just a few minutes before the meeting.
Great. Okay, then I will go ahead and stop the screen share. So that means that you all have that in front of you. So we can go there, we can adopt this. It's actually a free tool. There's more that we can do. And let me get back to my screen, apologies. Okay. Well, you all have gone away, so hopefully you can still hear me. Anyways, I don't want to take a bunch more time. My goal was really to kind of expose us to the concept of racial equity toolkits, to be here for any questions. I may not be able to answer them, but I would certainly do my level best. And I want to go stop there and see if there's any feedback.
Mike, what is, from your perspective, what is if this committee decides to implement this, what are the next steps after that?
Well, that's an excellent question. And I think in the steering committee meeting, we should really look at that. So my goal here is to expose people to it and to see if there are any questions, concerns. But really, we could look at it from two ways. Do we want to start with something as simple as adopting a racial equity toolkit and then pledging to use that? What that could do, and we are in the crisis stabilization, we tried to think about what would that do for each subcommittee. So for the behavioral health subcommittee, if we're recommending some kind of a expansion of an intervention at Bridget Collins that is going to support families, we would then make sure that we've gone through our list of questions to really evaluate that. Were there any unintended consequences that we missed? So I know I'm skipping ahead to when we adopt it, right? And obviously I'm hoping that that happens. But I think that's what it would provide, is kind of a tool for all of us in our work in these subcommittees to go through and just to check all of those boxes to make sure we're doing those pieces. And I would articulate too that even the discussion, Dan, that you led us through about representation, about who's on this group and who's not, and comments that Arlene made, this is exactly the type of but instead of having it be ad hoc and just somebody thinking about it, we will ask this as a matter of course and as a matter of process in every step that we do. And I don't know that I answered your question, so if I didn't, let me know.
No, that's fine. I think I guess I'm asking, is there an order of operations to this, i.e., like, should steering take a look at this and, like, this is kind of like a briefing and kind of like a heads up, and here's like the list, here's the of what you would consider. But should steering be the kind of the adopter and then make the recommendation to the committees? Does that sound like a way to do it, or not?
Yeah, and I might defer to Stephen a little bit and Jill on process, but I believe, Dan, that you have said that actually extremely well, that this would be kind of exposing groups to it so people can think about it. It's not the first time you hear it. Everybody gets a copy of the toolkit for steering to talk about. And it's my understanding, and Jill and Stephen can correct me, the steering would really recommend to the committee of the whole then, and the committee of the whole would be the adopter. And Stephen, maybe you could speak to that a little bit about the process and maybe with Jill's assistance.
Yeah, thanks, Mike. I think that is the way we've been talking about it in the steering committee. It's going to come up later this week in the next meeting. The idea would be potentially steering might recommend the adoption of this or another framework that would guide the work of the task force. Understandably, as Jack Ovenier reminds us all the time, we're simply an advisory group to the county council. But for our work, for our deliberations, for our recommendations to the council, adopting a racial equity framework like the GARE tool would be a way for us to be covering all our bases. And there are all sorts of examples of recommendations we've made where these kinds of racial equity considerations were really never discussed. I mean, I think we may have had individual and anecdotal kinds of senses of the benefits or the drawbacks of a proposal, but we've never really approached them in as systematic a way as the GARE tool, for instance, would call for us to do. So I think there's value, and I think the steering committee thinks there's value in adopting a task force wide kind of framework. So I think that's where the conversations have been pointing, and we'll see what further steps the steering committee as a whole wants to take with that.
Byron Mannering.
Thanks. Yeah, I'd just like to say I support the idea of using a tool in some way to evaluate racial equity and DEI stuff. I think it would be really important as we're looking at implementing it is like, at what point in time does it get used? When do you use it? When's the decision being made that it gets used at? And it's not just this kind of blanket thing that you have that you are supposed to kind of look at, but so guidance to the steering committee about, for me anyway, to say, how often would it be used and in what circumstances would the tool be implemented?
Heather Flaherty has her hand raised.
Go ahead, Heather.
Just a couple of things too. I love GARE, and I believe that Whatcom County is considering becoming a member of GARE, which may open up some resources for us too, additional resources other than what they provide. And there are quite a few things that you have to do to actually be a member in terms of compliance. So Healthy Whatcom, maybe they would be a good group to invite to this committee or to the, sorry team, hold on. And secondarily, that groundwater training that some of us went to, that could be a great thing for the task force and others in government to attend.
Okay. I guess daughter Margot had a couple things to say there too. I think in support is what I heard. So Mike, any other pieces for this for today, or are there any other questions from the group?
You know, I guess if there's not another question, I would just offer one other thing that came up in the crisis stabilization. And the question was kind of like, how deep do you go, right? I mean, so obviously, this time to start asking questions like this or employing processes like this is in the very beginning. We started in 2015, so we can't do that. That doesn't mean it's a wrong time, but you can go as deep or as light as you can. And what others brought up, membership is amazing, and I'm applauding that, and I really hope that happens. That makes this Racial Equity Toolkit, it's a bit player in the whole membership piece. But I guess what I want to get back to is part of this can be so big and broad that really you do a full assessment of whatever the subject is. So say we're talking criminal justice system, right? Because you can use this in education and all types of other things. We're squarely focused on the criminal justice system. You could go very deep and doing a complete assessment and really kind of running your existing programs, your existing structure through it. That is going very big. It can also be more granular, which is a little bit more nimble, and maybe for us that are really suggesting maybe reforms or interventions or doubling down on programs, we could look at it much more like Byron was talking about, where we're actually at the time of making a proposal, right? We're making sure that we're going through this. So I guess that question came up in the crisis stabilization, and I would say both and would be positive, but we can't let the perfect be the enemy of the good. I think starting to use it, and even if we fumble with it, it is better to do that than to not. And so whether we can go deep in the beginning or if we start small and go with a free tool, I think we're going to learn powerful stuff from it any which way. But obviously, I think we would gain even more from a very broad-based assessment, but we would need help in that.
There's a really loud UPS truck that's going to go by here in a second.
Nothing like the Jess from Whidbey. So
I live in my wife and I live in a 960 square foot house, and we're both on Zoom all the time. And like I have to go to the front porch and she's in the middle. Sorry about that. And I realized my camera was on and I had you guys walk through the house with me. I thought I turned my camera off. That's bad Zoom etiquette. Always turn your camera off. You're going to be moving around. It's like bad horror movie. So don't do that. All right. Okay. Anything else on the racial equity piece? Mike, I just assume you're going to keep leading the charge on this one. You've been pretty serious about this. So
I think Jill recruited me for the roadshow. So please give me pointers. If there's something that can make that a little bit more interesting or exciting, please let me know. I do want to at least be a vehicle for exposing some of the subcommittees so that people are aware of it.
Okay. Thank you. And thanks for that work. Okay. Our next item here is other business. And I'll let other people go first. I have an item this afternoon. Okay, I see no hands. Oh, Heather Flaherty.
I don't want to take too much time, but I think at the last meeting you asked for an update on the children's work, and I don't want to lose that. And I can do that next time in a more formal way. But work is happening, and it's good work, and you're all invited.
And yes, and we should all participate too, because that's the future. I'm wondering if we can make an agenda item for our next meeting, or Heather, you could report out on that work. Okay, let's do that. Okay, any other folks? Okay, I do want to. This is absolutely germane to this body. Last week, the City Council voted 7-0 to direct the administration to come up with some funds for the development of a 911 co-responder program that is similar to Cahoots or to Portland's model or to the STAR program. So basically what it would do is provide a response for, in Eugene's case, up to 18% of diverted calls went to this unarmed response. Of the 24,000-ish, and I'm a little paraphrasing here, but about 24,000 calls, only about 150 needed a law enforcement backup, basically. And so these would be wellness checks. They'd be persons persons obviously unwell. They're not doing anything criminogenic, but normally we'd send a police officer because that's what we have for a response. So this would change that and provide for, in some cases, but not all, a response with a designated crisis responder, a nurse, and what I'd like to see is a second van show up with a community health worker to stay with that person to try to get a care plan going for just a slightly longer term plan for that individual. The models that I've, in addition to the ones that we talked or I just mentioned here before from across the country, MCOT really is a very close model to what this could be. Doug's spoken about MCOT before, and I think that kind of lodged in my brain as to what a response could look like. What we're doing simply is we're doing initiation at 911, not officer discretion. That's really the kind of animating difference between those programs. Although, Doug, if there's more, if I'm missing something, just jump in. But basically what we're what we're looking for is a mental health response. I'm hearing loud and clear from my constituents. They're demanding that we respond to this in a way that is meaningful and gets people the help that they need. So we'll see what happens with administration. Seth, I don't know if you want to, or Mayor Fleetwood. I've known Mayor Fleetwood for about 25 years, so my mistake there. But
don't be silly.
You want to have me? Go ahead, sir.
Well, no, I'm just glad you put it forward. I mean, as you well know, the program development is going to require a lot of conversations. There's discussions right now as you observe lots of different models that work. There's going to be an open question as to what degree do we evolve and adapt some of our existing programs into programs that maintain in a better way the elements that we've found that are positive in others. As we've all learned, Cahoots took a long time to build, and lots of money. There's aspects that we don't have right now for Cahoots. And so I look forward, I think, as we indicated, Dan, we're going to bring that back. We're going to work with you in the coming weeks and put together the outline of how we could do this. I agree with you. There's broad agreement that we need to move and evolve in precisely this direction. So I don't think there's going to be pushback on that. It's just going to relate to detail and speed. There's going to be a budget component, which is complex because we're in a year where we'll be coming out with this in greater detail, but we're anticipating that we'll be somewhere in the neighborhood of probably a 7% reduction next year over 19 numbers. So Dan, you and I will be working lots in the coming weeks on this very topic, and we'll keep you posted. Doug? Oh, sorry.
Like I said, Dan, MCOT I think is real close, so we don't have to recreate the wheel here. I mean, the backbone already exists here in our community. Really the difference between Cahoots and MCOT is 24/7 response, because right now there's a delay, and a lot of those people that we're responding to, they need help now, you can't refer them 24 to 48 hours because something catastrophic is going to happen potentially during that time period. So that's the frustration from the law enforcement side. Is you're right, and you're not going to get an argument from law enforcement that there's plenty of these calls that we're not the appropriate resource. Now we train our people on it, and they do a great job. And if somebody calls 911, we don't say no, we're not coming. We show up and we do the best we can. But the problem is the backbone exists. There's just not enough resources to go around. So that's and I think Mike Hilly can probably agree with me. I think that there's going to need to be MCOT and that 24/7 capability that goes through dispatch, but there's still going to be those situations where law enforcement is appropriate because it's, quite frankly, it's going to be too dangerous. And if they're not on scene, I'd like to see, maybe 1 or 2 teams that are more of a co-responder, where you've got law enforcement, you've got community paramedics, and you've got behavioral health clinicians all on one team. So then when you go, whoever's the most appropriate person steps up front, the other 2 step back, and they can handle the situation. And that way it's efficient, it's effective, and you don't have that delay in time.
Yeah, I agree. I think there's a lot of possibilities for blending different models together, and I do agree that the law enforcement is going to have to be a part of the composition for many calls. That's just, I think, just reality. One thing I do want to respond to the mayor. One thing that's different than Eugene and Bellingham, other than like I think we're a better community, much better. That's my personal preference, and Whatcom County too, in terms of the ability for us to identify and implement meaningful services. Look at what we've got on the ground already: community paramedic, MCOT, hot team. Mike, that's you were part of that for a while until you got promoted. There's PAC. There's a program for assertive community treatment that's run out of Lake Whatcom. Lummi Nation's a leader, in my opinion, in terms of treatment options. I think there's a lot there already, a very good base. And Kahoot started in 1989, and you look at the viewpoints on behavioral health in the 80s versus now. I think we're in a much different environment, and locally on the ground, we've got the capacity. So, Mayor, I'd urge you to. There were some offerings out of the Grace folks, Gail DeHogue and Melora Christensen, offered to, perhaps develop the architecture for what a 911 response could look like here locally. And Jenny Billings, who's the executive director over at Lake Whatcom Residential Treatment Center, and Britta Johnson, who was who after the Aurora theater shooting in Colorado was the person at the state level to try to get something going on a 911 co-responder. So they are absolutely interested in operating. One of their board members, Gail DeHogue, was a resounding yes to that as a possibility. So what I'm saying is that the players exist within the community, and to Doug's point about its resources, absolutely, we don't have enough, and it's going to come down to funding. And there's a cost savings here. It's indisputable that there's a cost savings when we don't send a paramedic or we don't send law enforcement, and we do send a social worker who's paid at a different pay schedule. So, and I do realize that there is a pain point when it comes to implementation, fully aware, and the 7% decrease. That's reality right now. But I'm here to work with you and your team, and look forward to that. Okay.
Let's queue up a meeting with Melora and some of the people that you mentioned, because we were at some meeting last week where their names were mentioned. We need to sit down. Well, I don't know if we can sit down. Well, we can sit down. I don't know if it'll be in the mayor's boardroom or a Zoom call, whatever you want. We can get like 6 people in the mayor's boardroom and be socially distanced. I'm still trying to go back to the old ways, but let's make a meeting happen soon.
Okay, thank you. And thanks for your leadership on this, Mayor. This is a very important. Mike Healy, go ahead.
Yeah, thank you so much, Dan. I just want to say I appreciate your work and edging us in this conversation. This is something that myself, Gail, Melora, the leadership at Bellingham Fire Department had been talking about for almost 2 years. And we feel like we have that infrastructure there. We feel like we have a foundation to get this going. And we do have some ideas on how to move a project forward that will benefit both the city and the county in a co-responder model. Megan and I talk about this every now and then as well over at Lummi, which is how can EMS help the Lummi community as well with some of their issues. And we have a dream team kind of a idea that actually would tackle the SUD issue, the overdose issue, along with the mental health issue, using these co-responder teams. And I go back to what Doug mentioned, which is you really have a flexible team that can respond to any of those types of emergencies. And yeah, you have an officer that can kind of make it safe, that stands in the background. And maybe this call is an opiate overdose call with a mental health aspect to it, and we want to divert to the CSC. I feel strongly that we can divert as much as 75% of the SUD detox patients over to the new facility as opposed to the ED. And to some degree, the same amount of mental health patients could be diverted over. And we'll change the conversation and be able to understand what that looks like in a new model. So I would enjoy that conversation. I know Ann Deacon would. And we are about halfway there in an idea, I think. But as mentioned, obviously, we have to talk about money and support and that type of thing. But I think we're close to that.
Okay, Mike, I think it would be important for you to help select some of the people that need to be on that call with the mayor, if you'd be willing to be part of that team.
No, I'd be glad to. That's been a long passion of mine for years as a working paramedic and now in leadership, knowing how those programs can help so much. So absolutely, I'll do that.
Okay, that sounds great. I really appreciate that. Let's see. I'm looking for raised hands. Anyone else have comments on this subject? Okay, seeing none. Any other business for today for the good of the order? Okay, seeing none. I guess we go to public comment. In our public is a council member and a council staff person. Would either of those folks like to comment? Okay, seeing none. Well, everyone's got their, well, not everyone, like well, Mike's got the baby, Heather's got her baby. I don't have my grandbaby. I kind of feel a little bit, like I should bring her next time. I'll see if I can do that. Y'all, thank you so much for the work that you're putting in during these times. Thanks for sharing everything that your agency is going through. It's challenging. I feel that this, for me personally, this is a connecting point with my peers and my colleagues, and I look forward to our next time. I'll report out on the items that I indicated during my remarks, both from steering and some of the other pieces at our next behavioral health meeting. Anything else for the good of the order today? All right, then seeing none, y'all have a good rest of your afternoon. Take care, and we'll talk to you soon. See ya.
Thanks all.